Hi, I'm Dr. David Hill, and today we're going to talk about treating nighttime acid reflux. Now, acid reflux is a condition where acid from the stomach, and often gastric contents, like what you just ate, come back up into the esophagus. It's supposed to be a one-way valve. They're not supposed to come back up, but in many people they do, due to a variety of factors. Obesity may play a role. Smoking cigarettes plays a major role. The use of alcohol or caffeine can contribute. Eating greasy foods or fatty foods, or just eating a meal that's too large can contribute. Now, a lot of people get their reflux at night. Why is that? Well, when we lie down, we don't have gravity working for us. All of a sudden, we're flat. And the gravity that might be holding gastric contents where they belong isn't helping us keep those things there, and they come up into the esophagus. Now, there are a few things we can do. The most obvious are to cut out the things that make reflux worse. Again, the fatty meals, large meals, alcohol, caffeine, cigarettes. You want to lose weight if you happen to be overweight. But another thing that you can do is eat a little bit earlier. You'd like to see ideally 3 hours between the time that you finish your meal and the time that you lie down to go to bed. Now, how you lie down also makes a difference. Ideally, you'd elevate the head of your bed if you can do so safely using cinder blocks or bricks or some sort of other wooden block. You could put something under the mattress to elevate the mattress as well. When you lie down, you want to lie on your left side. We have a fancy term for this as the left lateral decubitus position, but what it means is your left shoulder's against the mattress. It's just that simple. That creates an angle that makes it a little less likely for stomach acid to come up into your esophagus. Now, medications can also be very useful. The most simple and short-term medications are the antacids like Tums, Maalox, and Mylanta that just neutralize the stomach acid in your stomach. A more medium-term solution are called H2 antagonists. Why that? These are antihistamines, but they work against the histamine receptor type 2 instead of the histamine receptor type 1s that fight allergies. Those medicines are ranitidine, Zantac, there's Pepsid AC, these all end in adine, nizatidine, ranitidine, etc. You can find most of them. Cimetidine is another one. You find most of those over the counter at your pharmacy. Now, for long-term control and for the most potent control, you can use a class of medications called proton pump inhibitors. The most widely available of these is the over-the-counter omeprazole or Prilosec. This is a highly effective medication, but if you find that you're needing to treat reflux in any way for more than about 2 weeks, do seek care from a doctor. Chronic reflux can be very dangerous. It can cause scarring of the esophagus. It can even lead to esophageal cancer. So this is not something that you want to sit on for weeks or months on end without having adequately controlled. It can be very challenging to get it under good control, and sometimes you need the help of a gastroenterologist, a stomach and intestine specialist, to make sure that everything is working and that you're not at risk of significant complications. Talking about treating nighttime gastroesophageal reflux, I'm Dr. David Hill.